Good morning, good morning, good morning, everyone. Welcome to Health is Wellness. We're so glad to have you. We're going to give everyone a few minutes to get in here and join us. Thanks for coming in. Let us know where you are joining us from. I am in beautiful, sunny California this morning, and so excited to talk with you all today. So give us just a few more minutes, just a couple more minutes here. We're going to get started. Good morning. Welcome to Minorities for Medical Marijuana Health is Wellness webinar. This is our June edition, and we're so excited to have you all with us. Welcome, everyone. All right. We are 2 minutes in. I want to make sure that we are utilizing our time wisely here. I'm going to give everybody about 20 more seconds, and we're going to get ready to go. Welcome, everyone. Welcome. All right. So, welcome to everyone. This is June 2021. We are so glad that you could join us today, June 26th, for the Health is Wellness webinar. June is Alzheimer's month and Brain Awareness Month. I'm not sure if all of you are aware of that, but that's what we're going to be talking about today. So if you or someone you know is dealing with this type of diagnosis, whether it's dementia or Alzheimer's, anything that afflicts the brain and its function, this episode is for you. What is interesting about this particular diagnosis, of course, is that when you, become diagnosed with this type of disease, you really need a caretaker. You need someone there helping you through the process. So we're going to talk a little bit about that today as well. Make sure those caretakers have some resources to help them along, taking care of their loved ones. So June is Alzheimer's and Brain Awareness Month. We're going to get this going. Everyone who has a brain is at risk to develop Alzheimer's disease, a disease that kills nerve cells and tissue in the brain, affecting an individual's ability to remember, think, and plan. As the disease advances, the brain shrinks dramatically due to cell death. Individuals lose their ability to communicate, recognize family and friends, and even care for themselves. Alzheimer's disease, the most common form of dementia, is one of the nation's largest public health crises. It is the only cause of death among the top 10 life-threatening conditions in the United States that cannot be prevented, cured, or even slowed down. Worldwide, there are 47 million people living with Alzheimer's and other dementias. And without a change, these numbers are expected to grow to 76 million by 2030. But everyone can help to end this epidemic. In June, the Alzheimer's Association recognizes Alzheimer's and Brain Awareness Month, an opportunity to increase awareness and to address this worldwide epidemic. The Alzheimer's Association and its experts are sharing 10 ways to love your brain. And so I suggest that is a great article. Visit their website, and you can get some more information about how to love your brain. All of us have one, so we all need to take care of it. But today I am so excited to introduce our lovely guest, who's going to help us understand better how you treat, how you diagnose, recognize the signs, but how you treat with cannabis, or naturopathically, if that's the way that you prefer, and how you also best care for your loved ones. And so I'm so excited, as your host today, Nicole Buffon, to introduce for our June Health is Wellness webinar, the very lovely Dr. Kelly King. So excited to have you here today with us, Dr. King. Thank you.
Nicole.
Hi. Thank you again for joining us. We really, really appreciate it. So as we have you here this morning, I would love for you to just tell us a little bit about yourself, how you found your way to helping our senior population in treating their dementia or Alzheimer's, or different diseases that affect the brain for our elderly population.
Absolutely. So I practice as an internal medicine physician. I graduated about 20 years ago as an internist. I'm originally from in Florida. So I grew up in Oakland, California. And I went to medical school right around the time that medical cannabis program was coming online in about 1996. So I was always familiar with cannabis and medical cannabis and just people just using it for recreational purposes. But as I progressed in my practice and really started to see, if you're familiar with internal medicine, we practice geriatrics. Most of my patients are between 60 and 80 years old, or just for internal medicine, because it's the practice of adult medicine. So I see a lot, I've seen a lot of patients as they progress into their older years. Patients tend to accumulate a lot of medications as they get older. They go from, just needing a little Flexeril and Motrin to needing high blood pressure medicine, to needing diabetes medication, to needing antidepressants. And by the time they become 75 years old, they may be on 15 or 20 medications. And that's what I see now in my practice. I started practicing in medical cannabis around 2015, 2016. I started here in California with a telemedicine group called Hello MD. And when I started that, when I was interviewed for that job, they just said, okay, you're going to just be given, scripts for cannabis. I was like, okay, but people have questions. And especially when you're talking about older people, and even in California, 20 years into the medical cannabis program, I was still getting patients that were calling up going, what do I do? What's CBD? What's THC? They'd go to the dispensary and they'd be all confused. And and a lot of them would be caregivers for their loved one on hospice, or, my dad now has cancer and I want to help him with this. And because they were already comfortable with cannabis, they still had a lot of questions. So I felt that as a physician, number one, we didn't take the pot class in medical school. And number two, the onus is still on us to educate our patients. If a patient came to me asking about diabetes, I should know about diabetes. The same thing with cannabis. And so I decided to really do a deep dive into what this is really all about. I was like any other traditional doctor and said, they just, this will help their symptoms. This will, maybe not, but, it's not lethal. However, I developed a very strong respect for it when I really took a deep dive and saw what it was doing for patients, how it could help patients, and then just hearing from the patients themselves. I mean, I have probably over 2,000 patients now, and they tell me, this is life-changing. You don't understand. I'm off of 10 or 15 of my medications. This is what I'm using. And for a physician, that is really gratifying, because there's so much of what we do, we're just putting Band-Aids on. Cannabis really has the potential to help and treat patients in a more natural way, and without all of the side effects, without all of the things that you see with narcotics and antidepressants, et cetera. So back to your original question, though. So being in Florida, as you know, Florida is known as God's waiting room, because we have a lot of older people. This is where they come and retire and wait to see their maker. And so as my practice for medical cannabis has developed, it's really developed into an internal medicine medical cannabis practice, because people are coming to me and going, hey, I have 20 medications, I have AFib and hypertension and dementia and all of these things that I have to approach just like an internist would, and really take away all of the parts of what they're doing and try to find a common ground to help them with this level of wellness in their lives. We all go through different stages in our lives and different challenges. And when you're 60, 70 years old, that is a whole other stage of your life that patients need help with. So a lot of my patients, or their caregivers have dementia, in addition to chronic pain, in addition to high blood pressure. So a few things that I've learned about treating patients with dementia is that it is very multifactorial. So so you have to really break down not only what type of dementia. So there's vascular dementia, there's Alzheimer's dementia, there's Lewy body dementia, there's frontotemporal dementia, there's this mild cognitive decline, for an 80-year-old, right? I had a concern about my dad at one point, and I was like, hey, your memory's a little off, and then my dad's brother came back and said, the thing about memory is you can forget where you put the keys. That's one thing.
Right.
Forgetting what the keys are for is another thing, right? So when you are at a stage where you forgot what those keys are for,
right,
then you're talking about dementia.
Okay.
So in whatever form, okay.
And real quick, just to follow up the question, when we're talking about dementia, when these different types of dementia, are they recognized by their symptoms? Is there a specific test that has to be done in order to determine if it's that type of dementia? How does that?
Unfortunately, with dementia, it is a clinical diagnosis. So most of the gold standard diagnosis happen post-mortem. Okay, so once the person is dead and they look and see if there are Lewy bodies, or they look and see if there are extra amyloid plaques, which is a hallmark of Alzheimer's. But most of it is a clinical diagnosis, or vascular dementia. A lot of times you can look at a patient's history and make a pretty good educated guess on whether or not this is vascular dementia or Alzheimer's dementia, particularly in a patient population, a minority patient population, because we tend to have more things like high blood pressure, more things like diabetes, more things like CVA, or peripheral arterial disease. We tend to suffer with those things in our community a little more than other groups do. And so a lot of the dementia that we see, we call it Alzheimer's, but some of it is a lot of vascular dementia as well. Or it's a mixture. There's nothing in the rule book that says that you can't have 2 or 3 things going on that accumulate in dementia or a dementia disorder. So you could have vascular, you could have a little bit of Alzheimer's, maybe you have some Lewy body dementia. The symptoms tend to be the same, though. So it makes it difficult to pinpoint exactly what it is. Regardless, the treatments are woefully inadequate these days. The prescription treatments, the Ariceps and the Namindas and all of these little treatments that they have, they really don't slow the progression of the disease. They can
do? Do they even slow the symptoms?
They can slow the symptoms, but temporarily. So patients may see a temporary improvement in their short-term memory. But overall, the overall trajectory is completely unchanged. I mean, I see patients, in the hospital or in their nursing facilities, and they've been on, Namenda and Aricept, and they've been on all of it for years, and they're still have advanced dementia. So it really doesn't slow things down. And some people, it makes it worse. Again, because a lot of these medications, and if you look at the way pharmaceuticals are developed, pharmaceutical pills are developed to treat one condition or one symptom. Yes, they have some off-label uses, but the way the pharmacy paradigm is, I'm going to give you one pill for your spasms, and one pill for your blood pressure, and one pill for this, and one pill for that. That's how people end up getting on so many pills. With cannabis, which is the beauty of the plant, you can have 10 different symptoms and treat it with one plant. If you know which cannabinoids are within that plant and how to do that. So that's why people can get off of all of those pills and be treated with just the one plant. That's why this plant is still, in my opinion, still on Schedule 1, because pharmaceutical companies can't make money off of selling you one thing for 10 different symptoms, right? They would like to sell you 15 different things for 15 different symptoms. They make more money that way. So that's one of the reasons why we have to go through all of this,
right?
Just to be able to treat ourselves with cannabis.
And would you agree that that is why are now separating? That's why you see the separation of the cannabinoids.
Mm-hmm.
They still try to vilify THC.
Yep.
And now that they've descheduled CBD and made it seem like almost CBD is safer, because it have psychotropic effects. But once you understand the plant, it all does. Of course, CBD has psychotropic effects.
Of course, it's cannabis. It's all cannabis. They're trying to make CBD as if it's not part of the cannabis plant.
Exactly. Right.
And it's crazy. Yeah, I absolutely agree there. That's why they're trying to separate out the different cannabinoids without understanding that all of the cannabinoids work together. We take advantage of the entourage effect with cannabis.
That's right.
So without understanding that, they're making money off of saying, okay, you can just use CBD. And for some people, CBD is either not enough, or CBD doesn't work the same way in their with their genetic makeup that THC does. I have a lady that I've been treating for about 3 years with advanced dementia, and I've actually been treating her through her caregiver, because she was so advanced. She couldn't talk. She was very active in her previous life, and now that she was in this dementia state, she had become very violent. So she was hitting and beating up people, and CBD made her worse. CBD made her more violent. And one of the things I've had to learn in my practice is to listen to the patient, and to really let the plant guide the regimen, not what you think or what you've read in the books. The plant really guides them for what they need. Because of the way it works within their bodies, and everybody is different. So they were like, Dr. King, no, you don't understand. Because at first I was like, CBD, because it's not psychotropic. Right. I don't want to make a lady like this worse with the paranoia and the anxiety that you can have with high THC.
Right.
Well, that woman, they were like, no, CBD is just the opposite.
Right.
Even though it's not psychotropic. So we really started having to scale up on those concentrates. We really had to scale up on her RSO. We couldn't get her to even understand how to do a vape, or how to use it herself. So we finally found one of those sure shot things to give her a shot when she needed something really quickly.
Yes.
And she needed to smoke, because smoke is going to come on quick enough. The caregivers found her that. And so now she does nothing but THC, and she's probably on about 300 milligrams a day. Now they can bathe her. Now she sleeps better. Which is what a big part of dementia is they don't sleep. And when you don't sleep, you can't reset reset your system.
Right.
And so she's sleeping better. Now she's eating better. And it's amazing. It's a 2.5-year turnaround. And now I treat the entire family because they're like, hey, there's something to this stuff. Yeah, because this was a family that was way against it, but she had been on all the medications that they could find, and nothing was working for her.
That leads me to my next question. Thank you for that. Exactly. How do you, okay, for example, I use Dr. Knox's video when I'm introducing the TED Talk that she did, about 10 minutes long. It's the perfect
video.
Right. Very digestible video about the ECS, about the endogenous cannabinoid system. And so when I'm trying to explain to people, and I say it's easy for the whole family to watch, is there something that you would recommend? Because there's such a huge stigma, especially amongst that demographic. And not necessarily the ones that you're treating, but like you said, some of them are not conscious enough to even understand what is happening.
Absolutely. So there's caregivers that you also are treating.
Caregivers that would also have that stigma, because if I'm caring for my 80-year-old mom, I'm in the age range 60, 50 years old, where the stigma still exists, right? So what are there tools that you use? Are there certain conversations that you have? What do you recommend for those individuals that are trying to get over the hump of the stigma? To really help educate them and kind of open their minds to what the opportunities are here for cannabis and naturopathic methods.
Yeah, absolutely. So there are, there's those educational videos. I actually I give them seminars or put together something that gives them not only the things that the plant can do, but gives them a little background on why the stigma exists in the first place. Okay. We've been told, just say no. And if you look at Schedule 1, cannabis is grouped in there right along with PCP and LSD and heroin. And then there's poor little cannabis sitting there in the corner along with all these, real serious offenders. And now you get cannabis in there. And so it's been grouped in with all of these drugs. And so, and we have been conditioned to think that, cannabis is bad. And that was a specific and deliberate misinformation campaign. And a lot of people do not understand the history of cannabis. And so because they don't understand the history of cannabis, they automatically say, oh, well, if cannabis must be like LSD. I'm not going to give my grandma, my 80-year-old grandma, something that acts like LSD. And that's so far from the truth that it's laughable. And so when you really break down what the history of cannabis is, what the history of cannabis has been, even in this century, at the turn of the century, all doctors were using cannabis for patients, right? Cannabis has been around since 2700 BC. You look at all of the major civilized religions and cultures, they have all used cannabis in one form or another for one thing or another. When I talk to religious groups, I'm like, this is a God-given plant. This grows out of the ground, and it's been here for a reason. If you look at the endocannabinoid system and how it's evolved, why we have it. We have our own endogenous cannabis. Okay, our runner's high is not from opioid mediated endorphins. It's from cannabis when you get a runner's high, because we secrete our own internal cannabis. So when you can really kind of break it down like that for patients, then they get that aha moment, and you're talking to them at a point in their lives or in their medical lives that they're tired of all the medications. They've seen what all those medications can do. They've seen the constipation that narcotics can give you, and the drug overdose and the zombie-like effects that antidepressants can give you. And they're on all of them all at the same time. And all the Western doctors are all us internists, and these Western trained doctors can do is write for more pills. And so they're coming to me kind of with more of an open mind, but they're still a little put off by the stigma. So when we have those kinds of conversations and then we start them off, I tell people, we're going to start you off in the shallow end of the pool. Okay. We're not going to put you into that deep end of the pool. And that's because that's where a lot of people make their mistake, right? They go to the dispensary and they get, this heavy hitting indica or these high THC stuff. And that, in my opinion, is where the CBD comes in, is so that you can gradually increase that THC for patients without them having a bad experience. Okay, because if you've ever had a bad experience with cannabis, and a lot of us have, where you're peeking out windows now and you're like, oh my God, what did I do? It's going to be very off-putting, and so then they're not going to want to continue to explore. So you really have to start them off with a good with history of the plant, with this is how we're going to start you because this is what is going to give you the best effect right now. And then you take them in stages. You allow their receptors to start to get sensitized to it. And that's where the CBD and the THC comes in. And then before you know it, they come back and they're like, it's not a problem at all. Half of my patients, that's the first thing they'll say when they come to me. I didn't come to you to get high. I don't want to get you high. If you wanted to get high, you would not be coming to me sitting here for an hour talking about this. You would just go down the street to, Ray Ray and get what you need to get, right? But then when they come back and follow up,
yes,
it's the least of the issue. The whole psychoactivity for people, it's hard to explain what that is for them, right. But once they experience it,
right,
minus all the other stuff you get with all the other prescription medications, and now they're off of all the other prescription medications and feeling better, and they've lost weight, and their grandmother is now sleeping better, and the pain is better. A lot of people, when you talk about dementia and cognitive decline, it's you really do have to look at what else is going on. A lot of people, are in so much pain that because they're into the cognitive decline, it's hard for them to articulate the pain. But if you treat their pain, then their dementia gets better, their mind clears up. If you treat the constipation or you treat all of that other stuff that's going on with them, the sleep,
mm-hmm.
you can start to see that their cognition actually does improve. Doesn't mean they don't have Alzheimer's, but there are a lot of things that contribute to dementia that people overlook. And so that is my focus. And a lot of it is polypharmacy. Our old people are getting to have too many medications on board, too many.
Okay, so there's a couple of follow-up questions. I see Eric has a question about what is which cannabinoids have you experienced have the greatest positive effect when it comes to diabetes? I have gotten this question just as a caretaker, and I always go to food. And so that was going to be my other question about when you're looking at treatment options, are you also considering diet and what their bodies outside of just cannabis and the pharmaceuticals? Is that an important part of your treatment process?
Yeah.
And answer maybe Eric's question about which cannabinoids have you seen had the greatest positive effects for the specific diagnosis of diabetes?
Yeah, absolutely. So food is huge. I tell people all the time, cannabis is just a tool in your toolbox. It's a very good tool in your toolbox, but it also has to go along with diet, with exercise, just with mindfulness. You have to look at this as a wellness package. With cannabis being one of those tools that you utilize. So you do also have to talk to patients about what they eat, about their sleep health and their sleep hygiene.
Mm-hmm.
Are you exercising? Are you walking? Once you can get them out of pain and you can start getting those knees to not be so painful, then they can maybe get up and start walking around the block a little bit.
Right.
Once you get their depression under control and their sleep under control, you can start to get them moving and start to get them eating. But food and all of those other things are very important. Now, there are some people that come to me and they are obese or they have the metabolic syndrome, which is what I think Eric was getting to. There are certain cannabinoids that you can put them on, or that you can, and this is a challenge with the dispensaries because you can't always write exactly which cannabinoids you want this patient to have because they're selling flower or they have the full flower. But there are certain strains that have more cannabinoid, have different cannabinoid profiles than others. So THCV is one of those cannabinoids. Eric and I were just at a conference, and Dr. Smith talked a lot about the individual cannabinoids. But THCV and the terpene humulene, you'll find that in certain strains. The THCV works with the metabolic syndrome to help with insulin metabolism in our systems. So that's why you're seeing maybe 40% of my patients actually come back and say, hey, I've lost weight. Wow. And I thought I was going to have the munchies and gain weight. That was my biggest problem with doing this. But it's just the opposite. And a lot of that is because of the THCV. Humulene is a terpene that's found within a lot of the indica varieties that is actually an appetite suppressant. So if you have something that has humulene in it, you're not going to get so hungry. And THCV will help with metabolic syndrome. So you'll start to lose weight, especially in patients that are insulin resistant.
Okay, great. Thank you for that. And lovely information. I'm glad you mentioned terpenes because that's one of my favorite topics.
Love terpenes.
I love terpenes. And I live in a state, Nevada, space right now, and Nevada mandates terpene testing on all their products.
Wow, I didn't know that.
California, unlike Florida, I don't think Florida's doing that.
It's hit and miss. But it's certainly not mandated.
Well, it's one of the reasons that I moved to Nevada. It was when I was looking at these Western states to move to, and I had just started kind of getting into terpenes, and I'm really excited to know that moving to a state where it was mandated to print it on all the products. And so that was one of the things that that I wanted to ask you about is how do you educate, how do you teach your patients about terpenes when it's not something that's mandated in probably the state that they're living in, but it so much has an effect on, and then also the different ways that you can consume cannabis, because obviously, well, not obviously, because it's not obvious to everyone, but if you didn't know, folks out there, terpenes and cannabinoids will burn off when you combust, or when you put the cannabis flower under too much temperature, right? So it could also be steeping it, if you're steeping your flower, or if you're vaping it in a convection oven that allows you to heat it up and inhale the vapors. So you have to, there's a chart that will explain to you what terpenes and what cannabinoids burn off at what temperature. And that's very important for patients.
Absolutely.
To understand what that is, because especially during COVID last year, I started steeping my flour more because I knew that the COVID virus didn't like hot beverages, hot bodies, hot healthy lungs that were and so keeping that warm liquid in my body and steeping my flour versus burning it or combustion, I knew a better way to keep my immune system strong. Because I love burning my flour, I know that it increases the amount of mucus in the body, and obviously the disease lives in mucus and so on and so forth. And so I was looking for alternative ways to really get my medicine. And then I really started paying attention to those temperatures and what it means when you steep your flour or consume your flour and you heat it up, right?
Absolutely.
And so if there's any tips, or I'd like for you to expand further more about terpenes and all of the effects that they have, the physiological effects. When I go into a store to buy flour, I'm not looking at the THC percent.
You're looking at the terpenes.
I'm looking at the terpene profile.
Yeah. And that's what happens with my patients when I kind of take them to that next level. So I get patients that's been smoking all their lives, and they come in, I know this stuff, and then And then you start talking to them about terpenes, they're like, their eyes get big. And then you start talking to them about, how it burns off. Because I said, well, do you burn your flower? Or do you smoke your flower? Do you vape your flower? Then they get all wide out there. Well, what do you mean? There's only one way to smoke flower, and that's smoke it. I'm like, no, you shouldn't combust because it burns off. And I go through that whole thing that you just said. Right. And they are like, I did not know that. And I have been smoked. So when you take them to that next level from doing it recreationally to really doing it medicinally and understanding the plant on a deeper level, you got to talk about terpenes. You have to have the terpene conversation. You have to have the cannabinoid conversation. There's so many wonderful cannabinoids. There's CBG. CBG is the mother of cannabinoids. It's such a great anti-inflammatory. CBN. You don't want to use too much THC. Use some CBN to help your patient sleep. And then they're not going to get the psychoactivity if they're more sensitive to it. So, but the terpenes are amazing. And that's what I tell patients now. They're not even, you look at the nomenclature a lot of these dispensaries are using and the labs are using and the scientists are using, they are talking about the terpene profile, not so much this is a sativa, this is an indica. Right. Because those strains are going to change. They have thousands and thousands and thousands. You can't even keep up with the names of the strains anymore. At one point they had some relevance, but now it's just, they just put names on stuff. So the only way really to keep up with what's in that strain is by the terpene profile, because terpenes don't change, right? You have some primary terpenes, and kind of the way they are produced within the plant is what drives that final terpene profile of that plant. You can have the same strain. If it's cultivated differently, it's going to express different terpenes. And so you really need to know what those primary terpenes are so that not only what works for you, but what doesn't work for you. Right. Everybody's had the experience of getting a strain like, okay, that I didn't like that at all. It's because there's certain terpenes in there that don't work well for you. Absolutely. And you need to know that. Yeah.
Absolutely. And if you're operating within a black market in a state that is still illegal, then you definitely have no idea what it is that you're getting. None. By the time it gets to you, it hasn't been tested.
Nope.
In you're going to a dispensary, you have more of a chance of getting closer to that cultivar, whatever it may be. But if you're not, and you're getting it from your local weed man, then whatever he's calling it is whatever he was told it was.
And he don't know what's in it.
Talk to the farmer, and talk to through it. So
he does not know. He may be growing, and I know people in California now. They grow. My brother is a grower, but if they are doing it, on the off market, they're not going to be able to tell you what they don't. That's not their focus. It doesn't mean that that's not what they're interested. It's just that's not their focus when they're growing.
Right. Absolutely. And I think personally that the terpene profile has more to do with whatever type of cultivar it is. Just like you said, right. If you're growing a cultivar and the terpene profile changes, you could absolutely change the cultivar of that plant.
Absolutely change it.
Different. Yeah. Not the THC or the CBD levels. It's the terpene profile.
It's the terpene profile. That's why you can go one place and get Girl Scout cookie and go to another place and they still call it Girl Scout cookie and it's a completely different strain.
That's right. But it's the feeling, it's the effects that kind of know if it's that Girl Scout cookie. Let you know if it's that sour tangy.
That's it.
Feelings that you get. I know if I as soon as I hit something with high myrcene, I know it.
Yeah.
I can taste it first of all because it's one of my favorite terpenes. And then I can also, it's the feeling I get. I know when I hit it with high limonene because it's me that heady.
That's it.
And so that's why I'm so passionate about terpenes, because I know how important they are to the physiological effects of the medicine, but also to the healing properties. And we're kind of getting into what all of those are.
Yeah.
I feel like I'm in school when I'm learning. And I want to give classes because I want more people to learn about terpenes.
Absolutely. And that's why it's so important with having to have a medical program and having a medical doctor who understands that, because you can't, you really have to gauge the level at which your patient is at when they come to you. They've never, ever seen the plant, and they don't know, they're just trying to figure out CBD and THC. You can't hit them with terpenes. You just can't. It's a different level of education for patients. And so you can't just, every patient is different, and every level that they come to you with is different. So you have to meet them where they're at. And then when they come back, sometimes it takes me a year, because I follow up with my patients, and after a year, then we have the terpene talk, or if they ask me, then we start to have the terpene talk. Right. If they are already familiar and they've already been using, but they kind of have that, street level knowledge, and then you want to kind of take them to another level, right. then maybe they're ready for terpenes, because they now understand, because they know, they've had the experience. I had Northern Lights and I had Bubba Kush, and I like this because, and when they start to really look at the terpenes, they say, no wonder why I like that, because they can understand that, because of the terpenes. Cannabinoids are yet another level of education and understanding, the way those cannabinoids burn off, because that's a big thing for patients. They, people are used to, if they're using flower, they're used to smoking their flower. And they don't
those cannabinoids or those terpenes at
or
all.
They're wasting about 40% of their flower. And I tell them, you're wasting that's how I get them. I'm like, you're wasting 40% of your stuff.
You break down how much you pay for it.
Right.
And I'm not getting the best part. Wait a minute. Okay.
And you're not getting the best part. You can't reuse it. If you vaped your flower and you put it in a dryer vaporizer, you can use it in your edibles. You can reuse it. If you burn it up, it's gone.
Gone. That's right.
That's so all of that is a whole different level of education, but it's so very important once you really can understand, how you can control the effects of what you're using, and how you can then utilize that to really pinpoint that patient with Alzheimer's versus that patient with chronic pain versus that patient, with rheumatoid arthritis. You can then really start to hone in on what regimen will work best for them.
And so we'll update real quick. Hey, family, if you're joining us from wherever you're joining us, thank you so much. This is M4MM's Health is Wellness webinar. We are talking with the lovely Dr. Kelly King. She has been an amazing guest so far. I just wanted to make sure that everybody could find Dr. King. So we're going to have our producer make sure you put your website up.
Absolutely.
Before we go, because we're not done just yet. Could you tell us, in your practice, that you started in California at the beginning, and you're also practicing in Florida. Those are two different states when it comes to patient awareness about the plant, patients, use of the plant and publicly, all of those things. Could you tell me probably what is your biggest challenge and how you kind of overcome that challenge when you're dealing with this elderly population? I know we've talked about the challenge of, getting over the stigma and the challenge of the education. I want to make sure that we're giving some pointers to our caretakers out there that are wondering if this is the best option for their parent, their loved one, the person that they're taking care of. And how do they begin that conversation? How do they find you if they can't get to you in California or Florida? Is there a telemedicine option? But what are some of the best ways to get to point them in the right way?
So there are telemedicine options. I actually just took a position as a medical director for a telemedicine platform that is introducing medical cannabis as one of their offerings. So this is called RC Enterprises. So they're nationwide, and they're in all the big medical markets, and they do urgent care and regular doctor's visits. But now they are introducing telemedicine medical cannabis, and they've hired me to be their clinical consultant and medical director for that offering. So in places like California, places like Oklahoma, places, Mississippi now has telemedicine for medical cannabis. New York has telemedicine for medical cannabis. So yes, there are telemedicine options. In terms of how I have the conversation with patients and how to kind of get over the challenges. The primary challenge I see is fear, right? Fear is, and that's almost ubiquitous in life, is we have to get over our fear in order to move forward. And this is no different. And so they have fear of taking them off of a pill that they've been on for 20 years. They know it's not working. That's why they're sitting here with me, but they still want to give grandma that pill. So taking them off of the pill, even getting them to go into the dispensary. So I'm working on a project now where we're going to do field trips for new patients and take them to the dispensary and take them to tour the different dispensaries when they get their new card and talk to them about the different products. The other challenge I see is the differences in dispensaries from region to region and what they offer. And so if you have your doctor recommending things, that doctor also has to know where that patient can go to get those things, because certain markets, certain medical cannabis programs, and this is one of the things I know Eric and Minorities for Medical Marijuana work on, is getting programs to actually be real programs. A lot of these programs in these states, they say they have a medical cannabis program, but they don't. The dispensaries aren't there. They don't, and that's a challenge when you're trying to recommend something. We had early on, there were doctors in Florida that were telling their patients, "Oh, go on down there and you get you a cookie and get you an edible, and that's what you should get." We didn't have edibles in Florida until last year, and they didn't know that. And so they had poor patients going to the dispensary looking for
edibles,
and they're not there. And then the patient's like, "Well, hell, what do I do now?"
Yeah, just like you said, in the state of Georgia was the state from in 2019. I launched the chapter there for M4MM in 2018, and at the time they had a medical cannabis registry. The state was not considered a medical cannabis state because they were not selling any medical cannabis products to patients, but they were allowing medical patients to sign up for a registry if they qualified with one of their 7 or 11 diseases at the time.
Right. And pay the state to do that. Yeah, the state's making their money.
And so now, since I've left, and I think the governor just signed off on this, they are going to allow medical cannabis dispensaries in the state of Georgia. Still no flower, no concentrates. They're going to allow, or no edibles. I think no flower, no edibles. They're only going to allow concentrates, topicals, and everything
like oils.
Everything has to be under 5% THC.
What? What is that? That's nothing.
Why are these legislators making a decision about what me and my doctor should be deciding? Why are y'all writing prescriptions? I don't understand.
Right.
Just legalize the plant, get your little money off of it. It's gonna fatten your pockets.
Exactly. And stay out of it. And stay out of it. I mean, we're fighting that fight now with this 5% cap in Florida. And that's a big thing about having patients and really trying to educate your patients, because once those patients are educated, those patients become advocates and those patients vote. Okay. And that's
because now they understand what they're talking about.
Right.
Like you said, it goes right over their head. When you start talking about percentages of THC, they think that these legislators know what they're talking about.
Right.
It should be under 5% because that's safer for us. No.
Right. No. They have no clue. Have no clue. But once they get it, then once they understand what's at stake, and understand that these are people that would rather have us get a prescription for Dilaudid and fentanyl and all this other crap that could kill us. They would rather us get a prescription for that.
Yes.
And limit THC to 5%.
Limit the amount.
Because it's safer. Okay. It's crazy to me. It
Yeah.
is absolutely crazy to me.
Yeah.
That's where the fight is. That's where you talk about the challenges. That's where the fight is at the legislative level.
Right.
Because these are people that they're not patients, they're not doctors, they're politicians, and
Mhm.
that's what's gotten cannabis where it is now because of
Right.
politicians,
Right.
politicians and money. You
And
know, it has nothing to do with the safety profile of the plant. It has nothing to do with how the plant helps. It has nothing to do with that.
nothing.
Yeah.
And the what is, I guess, the most frustrating is that they know the truth because they
They know the truth.
so long. And they've done a great job of lying to us about
Mhm.
keeping the truth from us.
Yep.
So as we kind of wind down in our last few minutes here, I really want to make sure that we are giving our caretakers out there as much resources as possible.
Yes.
We have your
Yes.
website up here. We leave
Yes.
online. That's
Yes.
probably the best way to reach out to you.
And let me give you my address in Florida. I'm going to do a blog on Alzheimer's. Oh, and this I was in the airport coming, and this is in this month's Mayo Clinic Understanding Alzheimer's. So if anybody wants to pick up that magazine, I thought I reviewed it while I was on the plane. It's a very, very nice magazine. It takes you from diagnosis to treatment options. So look for that. And I'm going to do a blog on my website this
Is,
month.
is cannabis mentioned in there in that article?
Not at all.
No.
Not at all. Not. I looked through it. You know, they say diet. They have some mindfulness stuff back here and how to treat it, but not at all. You know, and some of the latest research for Alzheimer's and cannabis, they really are saying that THC can actually stop the plaque formation and the progression of plaque formation. So not only does it treat a lot of the symptoms associated with Alzheimer's, it can really start to treat the progression of this disease, which there's no medication out there that's prescription medication that's doing that.
Right. No synthetic medicine.
No
Um,
synthetic medication.
Before
Yeah.
we go on to your next, when mentioning your blog, I wanted
Mhm.
to ask you about psychedelics,
Mhm.
specifically psilocybin in treatment
Mhm.
for Alzheimer's and dementia. Are you aware of those treatments? I know that it's still almost a very new
Yeah.
option for naturopathic treatment. So could you give us a little bit of your what you know about using psychedelics or psilocybin?
Yeah, I know that there are many of my patients will microdose with psilocybin. So psilocybin is one of those psychedelics that can kind of reset the brain cells, especially there in the limbic system and the hippocampus. And so I've seen some great results with psilocybin. I haven't, I don't prescribe it or anything, but I've seen some very good results if you're doing it in a microdose fashion. So yeah, I've seen it. You have to be careful, obviously, with it because of the psychoactivity and doing it in large amounts. Same thing with cannabis. Microdosing is what you need to do. But microdosing with psilocybin along with cannabis can be very, very helpful for patients, especially with certain symptoms of the disease. That's one of the big things you want to do if you're a provider or even if you are a caregiver, is understanding the symptoms of that particular disease process. So there are many people with Alzheimer's disease, but everybody is different. So your loved one may just have sleep problems. They may just not eat very well. They may have a spectrum of problems that are progressing from paranoia to anxiety to those kinds of things. And so you have to know how to treat them at each stage. So psilocybin can certainly be effective for some of those things.
And just for everybody's knowledge, psilocybin, we're talking about mushrooms.
Mm-hmm.
Magic mushrooms would be the street terminology for
Yeah.
them. Psilocybin is the medicine that those mushrooms make that give
Mm-hmm.
the effects that have the medicinal properties. And like she said, it is not. Do not just get it from anybody. Don't buy them online. It is a very because it's a spore, because it's a mushroom, it's a fungus, and so how it's grown, who grows it, all of those things matter and when you're consuming it. And so you want to be very careful. I would highly recommend going to a legal market. They're legal now in Oregon. There are a couple more states that have come online before you decide to go down the road of using psilocybin. And then, of course, like she said, it should be in a controlled environment. So you want monitoring you. It's not something you want to do by yourself, especially for the first time. And if you're giving it to someone, obviously, and they don't know that they're going to get ready to take it, obviously you want to be present and make sure that somebody's with them at all times and take them through the process. Because there's a lot of talking them through the process and talking them like, no, your skin is not peeling off.
Right.
Calm down.
Right. Exactly. That's those, and those are the things, you know, when they talk about, oh, this isn't controlled. Oh, we don't have research study. Oh, we don't. So part of those clinical trials with psilocybin or cannabis or any of it, part of those clinical trials help us understand the dosing. They help us understand how things should be grown. Whenever you're dealing with something that grows out of the ground, the way those things are cultivated is very, very important to the mature plant and ultimately what you're putting in your body. So you can't just, you just can't take it from somebody that's, growing it maybe in their backyard with their dog poop fertilizer. I mean, you really have to understand where things are grown and where it comes from before you put it in your body.
That's right. And I know we've been talking about Alzheimer's and dementia today a lot as well. But it's also Brain Awareness Month. So that's not just those diseases. You've got traumatic brain injury. You've got PTSD that afflicts the brain. These are all diseases that afflict the brain. And even now more with PTSD, they're finding like physical differences in the brain, chemical brain. And so, even though we think about it as a psychological disease, it's not. It has physical effects.
Absolutely.
Body, your mind. And so there's more than just, Alzheimer's and dementia. And since all of us have brains and, a car accident that causes a concussion, that can,
Right. That's right. A traumatic brain injury. That's exactly right. And now all of a sudden you have, dementia or you start to have cognitive impairment. And it doesn't mean that it's going to last forever, but there are so many things that can affect your cognition. And if you look at the way the endocannabinoid system is set up there, so that's why you have so many CB1 receptors within your CSF. I mean, with PTSD, a lot, if you look at Ethan Russo's work, he believes that you're just not producing enough of your endogenous cannabinoid, right? So you just have a cannabinoid deficiency. So if you're just supplementing with phytocannabinoids, that's why people with PTSD will tell you, no, I feel normal. I don't get high. I just feel like I'm normalized now.
Balance.
It's the balance.
Endogenous cannabinoid system's job is to create balance.
Homeostasis. Absolutely.
Okay, so we've talked through it. Oh my goodness, so much great and valuable information. Thank you so much, Dr. Kelly King. Please, before we go, please share. You were going to mention your blog. You're doing a blog and your location in Florida. Please finish telling us what you have going on.
And then I do several things in Florida. I do talks and seminars once a month. I do a patient wellness day once a month that we're starting to televise. I'm on Instagram. I'm on Facebook at ReliefMD. So I'll put that. That's my Facebook. So you can find me there, and you can find me on my Instagram. So I do blogging on my Instagram sites and talks. And with the pandemic, we were doing a lot of video. But now since everybody's getting out, I'm at the conferences. So I will keep everybody up to date on my websites. And if they ever need to call for a consultation, I'm happy to do that.
Perfect.
Okay.
Thank you so very much, Dr. Kelly.
Very well.
We're here on the West Coast. Both of us are in California, coming in from you all from the West Coast.
Absolutely.
Everybody all throughout the country that joined us today. You have been a part of the June Alzheimer's and Brain Awareness Month Health is Wellness webinar. Thank you again, Dr. Kelly King. We can't thank you. If this was valuable to you, please join M for MM. Visit our website at M4MM United. We are a nonprofit organization, and we love, love, love our members. It's what helps us to do all the work that we do. And so thank you again from Nicole Buffon, the Western Regional Director for Minorities for Medical Marijuana. We appreciate you joining us this Saturday for our Health is Wellness webinar. Thanks again.
Thank you, Nicole. Thank you for having me. This is a wonderful site. It's a wonderful organization, and I'm proud to be a part of it. Thank you.
Oh, we're proud to have you so much. Thank you so much.
Absolutely.
Take care.
All right. Bye-bye.
Bye-bye now.